What's up, guys? Chris Shear here from Kinetic Physical Therapy. I'm here to bring you part 2 of There's no one more qualified to evaluate your movement-related pain than a physical therapist. And let me say first off, I'm going to start with my disclaimers. As you know, I am a physical therapist. So all cards are on the table here. And for some, maybe this is when you tune out and you go on to the next video because you kind of already know my position. But I do want to explain my position at the same time. Because, truthfully, I think physical therapists have had to, and I'm old enough to speak to this personally, we've had to really embrace the idea of spinal manipulation over the last 10 years, okay? And again, I, as one of the dinosaurs in our practice who've been practicing for 15 years, I can tell you that physical therapists used to believe that spinal manipulation was a taboo, for sure, and they shied away from it, quite frankly, as long as they possibly could. Now, that said, we're asked all the time, what's the difference between a physical therapist and a chiropractor? And listen, if you're a chiropractor or you're under chiropractic care, please feel free to comment and throw some comments out there and ask questions and what have you. This is, again, I'm not trying to deliver any of these messages with any kind of vitriol or any criticism necessarily, but I'm just trying to explain my position as to why I think that a physical therapist is a better solution long term for your movement related pain. So, keeping along the lines of the disclaimer, as I'm saying, is like I said, is that I feel like physical therapists have had to up their game in the last 10 to 15 years to include spinal manipulation in their treatment. Because as I said, when I first got out of school, it really wasn't, and it really wasn't even encouraged, really. And ironically, it's the physical therapy profession who has really studied this. So when we say we're an evidence-based practice, that means we rely on systematic research to be able to justify what we're doing in the clinic. And that's one way that we are able to separate ourselves from the chiropractic profession. And I'm sure they've got their own research to support what they do as well, what gets done inside of a chiropractor's office. But we have evidence to support how we apply our therapeutic procedures as well. And I'll start with a story, a little bit of a story. So, this is many years ago at this point, probably 8, 9, maybe 9, 10 years ago, treating a woman probably in her late 30s at the time, and maybe mid 30s. Any rate, we're treating her for back pain. She had a history of a herniated disc, and nowadays we know that's not a big deal to have a diagnosis of a herniated disc. 10 years ago, that was a big deal, and physical therapists, wanted to see those scans and wanted to see the picture of the herniated disc. Now we don't really need to do that. We understand we don't really need to see a picture of it in order to treat it successfully. But the story is that I was probably seeing her for an episode, a flare-up of acute pain, and we're probably 9 visits into treatment. So 2 to 3 times a week for, let's say this is our 3rd week of treatment. And she looks at me and says, she's coming along, not making the same amount of progress as not making as much progress as she wanted to make within this time frame. And again, remember, this is at a time when, spinal manipulation from the physical therapist standpoint really wasn't something that we went to, especially for more chronic conditions, which this woman would fit into. And so she says to me, 9 visits in, I'm not getting better as fast as I'd like to get better. And, a lot of times that's kind of join the club kind of conversation, but she's showing progress. And she says, well, should I just go back to my chiropractor? And, this is not the first time I had ever heard that before. And so I said, well, listen, I'm not naive to the fact that, hey, whatever works for you. But, I just asked, so how many times over the years do you think you've been manipulated for your back pain? And she says, she kind of, I don't know, hundreds. I've said 100? Yeah, over 100, you think? And she said, oh, yeah, easily. And my response was, and you're giving me 9 visits? Right? 9 visits? If we're talking about back pain that has been reoccurring, and listen, we don't believe that anybody should deal with chronic and long-standing back pain. But at the time, I kind of felt like it's a little unfair, right? 100, I've been manipulated. My back has been cracked over 100 times, and I'm just fine with that application. And I'm happy to go back into the office for that treatment without any real resolution. I mean, if any other professional told you it would take over 100 times or more, or just continually doing the same procedure over and over again in order to, make your back pain livable, would that be livable by you? Would that be acceptable by you? And my challenge is, I don't think it would be. If we had to, if the hood of my car kept coming unlocked from the hood clamp mechanism, and I had to drive to CarSense every day or every 3 days just to pull into the parking lot, have someone come out and push my hood back down and click it into place. To me, certainly after 9 times, that would not be acceptable for me. Like, I would want some sort of, hey, let's see if we can't really let's fix this latch so that when we quote unquote push this hood back in, it stays in. So, part of my conflict, or part of my criticism, is the idea of having to maintain this progress by, hey, just pop in. It's a 10 or 15 minute appointment, and we'll just, we'll crack your back, we'll put you back in place, and to maintain your alignment, and everything will be a-okay. I suspect that if any other practitioner told you to do that, you would probably tell them bye-bye, and I wouldn't blame you for it. And we tell people routinely, if you're still coming to see us, 6 months from now for the same condition, and you're not better, then you should have been gone a long time ago. I mean, you should have turfed us and moved on to another professional that could really fix you and give you back your pain-free life. So the implementation of that and the maintenance part of that is something that we really have a hard time with. And I think, and we even believe that, chronic manipulation can lead to instability. And instability is a pain syndrome in and of itself. So the more you move a joint, the more you crack a joint, and the act of cracking a joint is pushing that joint past its physiological end range to create the crack. And when you do that, yes, are you providing mobility to that joint? But yeah, there are also structures like joint capsule and such that needs to stretch in order to allow for that. So over the course of time, if every time if every time you opened your door, you threw it open so hard that it made the hinges separate, sooner or later, probably sooner than later, those hinges are going to break down and they're going to become unstable. So that's an issue for the physical therapy industry as well in criticism of chiropractic. We feel like we should be able to make, and you've heard me talk about this before, we should be able to provide manipulative therapy when it's most indicated and wean off of it pretty quickly. And the way we've discussed that before is in acute management of low back pain. If you quote unquote throw your back out, as we've discussed before, and you have pain that doesn't go past your knee and you have good hip internal rotation strength, when you go see a physical therapist, especially a kinetic physical therapist, you're going to receive, more than likely, you're going to receive a manipulation in that case because you fit a clinical prediction rule. If you don't fit that clinical prediction rule, you're not going to receive that manipulation. And what we've learned over the years with our research is that the people who fit that clinical prediction rule, they need to have that manipulation then early in this injury process. And if they don't get that manipulation, they're going to be seeking treatment longer than someone who didn't fit the clinical prediction rule and didn't get the manipulation. Does that make sense? I hope that makes sense. And that's how we use or rationalize when we manipulate. if you fit a clinical prediction rule, and these are the same types of algorithms that your cardiologist uses to determine whether or not you could use a certain medicine or a certain therapy or a certain procedure. The same thing, same kind of algorithms your primary care physician uses. So the difference is really between a chiropractor and a physical therapist is that more often than not, I mean, I'd say probably almost 100% of people, when they go to a chiropractor's office, they're going to be manipulated. And a physical therapist doesn't believe that everybody that comes through the door with back and or neck pain need to be manipulated, because not everybody is going to fit that clinical prediction rule. So what's the hallmark difference between physical therapy and chiropractors? We also don't really believe that subluxations occur or are a problem. I mean, our spine has evolved over the years to be so strong and so good at its job. And let's think about its job. I mean, what goes right down the middle of our spine is our spinal cord. I mean, it's a really important structure, right? So, if joints could just willy-nilly sublux, I mean, there's not a whole heck of a lot of room. If this is a spine model of the lower pelvis here, and you're looking at the top of like L5S1, and this is the spinal cord, and these are the joints back here. I mean, there's pretty close proximity to some pretty delicate tissue. So if joints could just willy-nilly sublux, I mean, sublux doesn't mean dislocate, but sublux is on the way to dislocate. And if we need someone to put things back into place, I mean, that sounds pretty diabolical, doesn't it? And it's just not really, it doesn't really represent how our spine is made and how it functions. And like my hips went out, had to go in there, and my hip came out, so I had to get my hip put back in. I mean, what in the world does that mean? I mean, you can't see it here because it's not represented, but a hip joint has a ligament that attaches the socket to the ball of the ball and socket joint here. It has a ligament that holds the ball in there. There's nothing that's coming out. I mean, there's not. You're not driving yourself. Your hip doesn't come out, and then you decide you're going to make a decision to get in the car, drive to an office, and have someone put your hip back in. I mean, that just doesn't happen. And I think it's language like that, and it's psychology like that leads people to believe that they need this weekly, monthly, what have you. And to the physical therapist, that's just not appropriate, and it's not the way that you'll be. It's not a clinical prediction algorithm, or it's not an algorithm that a physical therapist would subscribe to. One final thing, the crack. All right, that manipulative sound that you hear when you have a joint moved past its physiological endpoint and you create that crack. People have become very reliant on that crack, and they need to feel it. It's almost addictive in a way. And listen, I'll be completely honest with you. When my motive is to manipulate someone's back, honestly, I'm not happy unless I get that crack. That being said, what physical therapy research has shown is that you don't need the crack to obtain the same level of neurophysiological effect as getting the crack. So as long as you get that quick stretch, as long as you provide that joint a quick stretch, you're going to get the same physiological effect as if you achieved that crack. Okay? And physical therapists are guilty of this as well. We think if we didn't get a crack, we didn't successfully manipulate, and that's just not the case. So, don't be so reliant on needing that crack, all right? Because you don't. I mean, we know that there's a reflex loop that goes through your spinal cord to the muscles surrounding that area, that painful area, and it creates a relaxation effect. It absolutely does. It makes the muscles relax, and it makes the muscles around it then, after the manipulation, kind of beef up neurologically and become a little better at strength and stability for a moment. If you don't learn how to train those muscles and really promote better rotational stability of your back actually try to bend your back because it's made to bend. When you retreat into maladaptive behaviors and you avoid bending, you avoid lifting, you avoid pushing, pulling, whatever, you're going to atrophy the muscles around your back, and you're going to become reliant on that crack, that maintenance care, because it's all the input your muscles are getting. And for a time it does feel better, but only for a short time. And then you need to reproduce that. You need to have that done again in order to get the same effect. I'm saying a physical therapist will manipulate when necessary in order to promote motion and early motion and exercise. And then once we can move, we want to be able to push, pull, lift, bend. We need to. And that's what's going to ultimately give you the long-term health and benefit and the wellness. That's what's going to give your back ultimate health. Not having to be tied down to an office that you have to go to every week, 2 weeks, or what have you, because you think your back is coming out of place or your hips are coming out of place. We know how to train movement so that you can improve and that you're less and less reliant on that care. So, all right, I think I've babbled on long enough. Again, I realize I'm a physical therapist and I'm speaking in favor of physical therapy, but again, I just think we are the best person to evaluate your movement-related pain, especially with regards to, in comparison to the chiropractor. We not only have the manipulative skills, but we also mobilize, which is a lower level of manipulation. We also do soft tissue mobilization. We also are very well educated in strengthening and stability training for all parts of the body. And our goal is to teach you how to, quote unquote, fix yourself, and so that you're not reliant on us for weeks and months and years. And we certainly want to be an added value to your life, and we want to be able to help you out periodically when you're down, or when you're not moving so well, or when something has cropped back up. We want to be that person that you call, and I know we can be, like I said, for any and all body parts. So thanks for listening. I certainly welcome any comments, questions, concerns. I know I didn't cover the topic in its entirety, but there's only so much people are willing to listen to, and I'm already at 17 and a half minutes. So thanks if you've stuck with me this long. I really appreciate it. And hey, give us a call. Let us be a part of your wellness team. And I assure you, you will not be dissatisfied with the care you get from a physical therapist. So thanks for listening. Stay tuned for part 3 coming up.